Mrs. Adams, my name is Teresa. I understand you're here for a TB test?
Yes, I am. We've been overseas and I may have been exposed, so I need to be checked out. Is this going to hurt?
It's not really a shot. It's more or less a pinprick, and it's practically painless.
Okay. So I suppose we should just get it over with then. But could you just explain things to me as we go along? I want to be able to describe this in a travel article I'm writing.
Sure. This needle has a small amount of harmless substance called PPD tuberculin. What I'm going to do next is inject this just under your skin. I'm holding the needle at a 10 to 15 degree angle because I don't want to inject too deeply.
Well, that's good. What happens next?
At the site where I inject the medication, you'll notice a small bubble appear on your skin. This is called a wheal. If the wheal is fairly large, it may mean that you have tuberculosis.
How long do I wait to see if it swells?
Well, what you need to do is come back to the office in 48 to 72 hours to have the swelling checked to see if you have a positive or negative reading. This reading is based on how large the swelling is.
Well, I guess I'll see you in 2 days.
Before you go, I need you to remember a few things to take care of the spot.
All right. Like what?
Don't cover the spot with a Band-Aid. Don't scratch it, and don't rub it dry if you wash it. Just pat it dry with a towel.
Well, what if it itches?
Well, if it itches, just put a cold compress on it. Okay, let's take a look at your arm.
There's nothing much to see.
Well, that's pretty good. It's negative.
I'll check your pulse first. That'll take just a minute. So just sit comfortably, and we'll be all set.
After Jillian has successfully measured Anita's pulse rate for 1 minute, she'll observe Anita's breathing rate for a minute as well. Each inhalation and expiration is counted as one breathing cycle. You don't want your patient to be aware that you're measuring the breathing rate because the patient can alter their breathing pattern.
Well, up next, I'm going to take your blood pressure. So would you mind rolling up your sleeve?
No, but take a little of the mystery out of this for me, because the doctor has told my husband to take his blood pressure every day. What is it that you're measuring, and how do you find it?
Well, right now, I'm looking for your artery to be able to hear your heart beating. This screw allows some air to escape from the valve. As the cuff deflates, I'll be listening to hear the first sound of your heart beating and note the pressure at which this occurs. That'll be your systolic pressure. Then I'll wait till I hear no sound at all. That's your diastolic pressure.
So what's the story on my blood pressure, up or down?
Well, your systolic pressure is up to 160, while the diastolic is the same at 82.
So what does that mean?
Well, your systolic measures the pressure when your heart pumps. The diastolic is the opposite, the pressure between beats.
Okay, so when you're listening to my heart, it's the first sound and then basically no sound that matters?
Basically, that's right.
What if you don't get a good reading?
Well, I'll check it again in a minute or two, which probably is what the doctor's going to tell me to do with you. Your blood pressure has never been high like that.
Yeah, I've been under a lot of pressure lately, both at home and work.
Inversion of red top tubes will encourage clotting by bringing more of the blood into contact with the surface of the glass. Terumo recommends inverting their red top tubes gently 2 or 3 times so more blood comes into contact with the silica-coated disc and begins the process of clotting. Do not shake the tube or invert it roughly, as this might cause hemolysis. All tubes containing the anticoagulant EDTA must be inverted promptly after filling to mix the anticoagulant with the blood. The anticoagulant will keep the blood from clotting and from clogging automated testing equipment. Hemolysis, cells rupture and release their contents into the serum or plasma, which could lead to inaccurate test results.
You have to wash your hands before and after, tending to each patient or piece of equipment that you use. The first step is to take off any rings, except for plain wedding bands or other jewelry. You can put your watch back on, but the rest of your jewelry should be stowed in your pocket. Or better yet, leave it at home so you don't have to bother with it in the first place. Stand away from the sink. You don't want to touch it with your hands, arms, or clothing. Turn on the water and adjust it so that the temperature is comfortable for you. Next, wash your hands and your wrists, making sure that your hands always stay lower than your elbows at all times. You don't want water, even clean water, running up your arms. And don't rest your arms on the sink. Apply soap to your hands and your wrists. Medical offices use special antibacterial soap, but that doesn't mean you don't have to do a thorough job. Scrub your hands vigorously for 2 minutes in a circular motion, making sure your fingers are interlaced periodically to clean between your fingers. Use the palm of the hand to clean the back of the other. You need to spend 3 minutes scrubbing. Rinse, then use a nail brush or orange stick to clean each nail. Lather up and rinse again. When you're finished, rinse your wrists and hands again. Remember to keep your hands lower than your elbows. That prevents contaminated water from running into your arms. You dry with a paper towel or 2, moving from fingertips to wrists. Once your hands are dry, use a paper towel to turn off the water so you don't recontaminate your hands. And dry off the counter with another paper towel, being careful not to touch the countertop. Non-sterile gloves protect your hands when you're handling specimens such as blood or urine for testing, or when you are cleaning instruments that have been used in office procedures. You will need new gloves for every patient you deal with, so you do not spread any kind of contamination. And to protect yourself, each time you take the gloves off, you roll one down off your hands and put it in the palm of your other hand. Then put your finger under the cuff of the other glove that's still in place and peel it down so that the outside of the glove never touches your skin.
In addition to universal precautions, you should also observe standard precautions. Standard precautions are infection control recommendations issued by the CDC. Standard precautions apply to blood, all body fluids, secretions and excretions except sweat, non-intact skin, and mucous membranes. Observing standard precautions will satisfy OSHA's Universal Precautions Regulation, provided that all other provisions of the OSHA regulation are met.
Lavender top sample tubes contain EDTA, an anticoagulant, and are used for hematology tests. In blood banking, lavender top sample tubes may be used for automated ABO and RH testing or viral marker screening. Each tube contains a specific amount of anticoagulant. Have the tubes on hand at the venipuncture station and securely positioned so they won't fall. You should not use any tube that has been dropped. It may have fine cracks and may have lost its vacuum. Do not store the sample tubes for more than one donor at a time at a venipuncture station. This might lead to mislabeling or filling the wrong tube. All tubes containing the anticoagulant EDTA must be inverted promptly after filling to mix the anticoagulant with the blood. The anticoagulant will keep the blood from clotting and from clogging automated testing equipment. Becton Dickinson suggests inverting their lavender top tube 8 times, and Terumo suggests 5 to 10 times for their lavender top tube. If you are filling more than one tube, you can invert the previous tube while you are filling the next one. Insert the next sample tube into the needle protector and open the clamp to fill it completely. Continue in this way, filling and inverting the tubes, until you properly fill all the sample tubes used at your facility. Samples of blood for testing are drawn into sterile vacuum tubes that are sealed with colored rubber tops. There are two main types of sample tubes that are generally used in blood banks. If a sample tube containing anticoagulant is not inverted, the anticoagulant will not be mixed correctly with the blood. In this case, some of the sample will have begun to coagulate and some will not. This situation can again lead to fibrin formation and increases the chance for inaccurate test results. This type contains a gel material to act as a physical barrier between the serum and the blood cells which have separated after centrifugation. The gel has a controlled viscosity and a specific gravity value that is between the specific gravity of the serum and the cells. During centrifugation, the cells are trapped beneath the gel and the serum remains above it.
Airborne precautions to follow include isolating the patient in a room with monitored negative air pressure, with the room door closed and the patient remaining in the room.
For surgical hand antisepsis, either an alcohol-based hand rub or antimicrobial soap can be used before donning sterile gloves. Nails should be cleaned with a nail cleaner under running water. But the CDC no longer suggests the use of a brush.
I'm showing students how to do a capillary puncture. And since Dr. Richards knew that you were coming in to have the procedure done, we thought you'd volunteer.
No, that's okay. I'm glad to help.
For a small sample, we don't use a needle, but an automatic lancet. It's spring-loaded and regulates the depth of the puncture. In the old days, they used manual lancets, but OSHA guidelines now forbid them. Since Mrs. Burns is an adult, the best puncture sites are the tips of the ring or middle fingers of the non-dominant hand. Avoid the index finger because the skin is thicker there.
If you're working with an infant, the puncture sites are different. An infant's fingers are not large enough to puncture without hitting bone. The best site is the bottom of the heel of the foot. If the child is older than a year or already walking, then you use a thumb.
When you're ready to perform the test, you need to wash your hands, put on gloves, and wipe the patient's finger with an alcohol pad. Once the alcohol evaporates, squeeze the finger 1 inch below the puncture site. Puncture the side of the patient's finger because the center is generally tougher. Immediately discard the lancet in the sharps container. Then, wipe away the first drop of blood with a gauze pad because it may contain alcohol or other contaminants that can prevent an accurate test. Gather a sample using a microhematocrit capillary tube. You can massage the finger to increase blood flow if you're having a tough time getting another drop of blood. Once you've obtained the sample, seal the tube with a clay sealer. How are you doing, Mrs. Burns?
I'm hanging in there. Oh, I can think of a few more pleasant things I could be doing.
Once you've got your sample, apply a clean gauze pad cover over the site. Now, Mrs. Burns, I just want you to apply continuous pressure until the bleeding stops.
How long will that take?
It should only take a minute or so. Once the bleeding stops, you can assess the site and decide if it needs a Band-Aid.
The chain of infection serves as the conceptual framework for infection control efforts because it defines the circumstances necessary for transmission of infectious disease. The chain begins with the causative agent or pathogen. To cause an infection, the pathogen must have a reservoir or habitat which supports propagation of the species, a portal of exit from the reservoir, a mode of transmission to a host, a portal of entry into the new host's body, and a susceptible host.
The first and most important tier of the new CDC guidelines is standard precautions. Since patient examination and medical history cannot reliably identify every patient with pathogens in their blood or other body substances, standard precautions apply to all patients. You must assume all patients are carrying pathogens such as HIV or hepatitis B or C. The first and most important tier of the new CDC guidelines is standard precautions. Transmission of these pathogens takes place by parenteral, mucous membrane, or non-intact skin exposure to blood and other body substances. You must take precautions whenever contact is likely with blood, mucous membranes, non-intact skin, or any other body substances, except sweat. The risk of infection can be minimized if all healthcare workers use the following standard precautions guidelines. Decontaminate hands before and after patient care, regardless of whether gloves are worn. If you are wearing gloves, decontaminate hands immediately after removing the gloves and between patient contacts. Wear gloves when touching blood or any other body substances, secretions, and excretions except sweat, or when touching contaminated items. Put on clean gloves just before touching mucous membranes and non-intact skin. Take care to prevent needle sticks and other injuries when using needles, scalpels, and other sharp instruments. Also be careful when handling sharps after procedures and when cleaning them. Dispose of used needles properly. Use a mouthpiece, resuscitation bag, or other ventilation device as an alternative to mouth-to-mouth resuscitation. These should be available for use in areas where the need for mouth-to-mouth resuscitation is predictable. Wear a gown to protect your skin and prevent soiling of your clothing during any procedures and patient care activities that are likely to generate splashes or sprays of blood and body fluids. Remove a soiled gown as promptly as possible and decontaminate your hands. Wear a mask and eye protection or a face shield to protect the mucous membranes of your eyes, nose, and mouth during any procedures and patient care activities that are likely to generate splashes or sprays of blood or other body fluids. You should immediately and thoroughly wash your hands or other skin surfaces after accidental exposures to blood or other body substances. Washing the potential contaminant from the skin may reduce the likelihood of transmission of any pathogen present. By following these standard precautions with all patients, you will be helping protect not only the patients, but yourself and other staff from the risks of infection with pathogens carried in the blood or other body substances.
It should be noted that the body substances covered by the standard precautions guidelines are more inclusive and cover more body substances than universal precautions.
Vital signs are measurements of 4 essential bodily functions that indicate the general health of the body. There are 4 vital signs you will take: temperature, pulse, respiration, and blood pressure. It is extremely important to be accurate when measuring vital signs because decisions about medication and treatment will be based on these measurements. The first vital sign to measure is temperature.
Dr. Richards has asked me to check your wife's blood pressure again to see if it came down any since you came in.
Why you have to do it 2 times?
Well, when she came in this morning, her blood pressure was a little high. It was 160 over 120. And the last time she came in, it was high, but not that high.
Они должны измерить давление еще раз.
Почему? Что случилось?
Я не знаю, ничего не случилось, ничего не случилось. Они должны измерить давление. She wants to know what's wrong.
Oh, nothing may be wrong. We just have to check it again.
Они просто должны проверить еще раз. Ничего не случилось.
Хорошо.
Hey, so how is the Fedorenkos this visit?
Oh, well, I wish I could speak Russian. I have to give them these samples and get them to understand how she has to take them, but I'm not sure how much English he understands.
I know what you mean. He nods and smiles when I talk to him, but I'm never really sure if he understands what I'm saying. And I've heard Rita raise her voice as if that's going to help.
Well, since it's very important that she understands that she has to take this medication every day without fail, maybe I'll call my friend Joe over at Berlitz and, get them on the phone together and have him explain it to her.
Oh, no, Annie, you can't do that. And Joe isn't trained in privacy procedures. Telling him about the Fedorenkos is against the law.
You're right. Well, what are we supposed to do then for patients who don't understand English?
Well, I know that some of the big clinics have medically trained translators, so maybe we could borrow one of them. We should look into that. But right now, I suggest that we use one of those web translating sites and have them printed out for the Fedorenkos.
Good idea.
Mm-hmm.
Instructions for your medicine. No, read it. I want to make sure that you understand.
Прочти, она хочет, чтобы ты прочла. Почитай.
Посмотри, инструкции даны по-русски.
Oh, по-русски. This is... She understands.
Good.
She understands.
Mr. Fedorenko, I'd like for you to translate it back to me in English so that I can make sure the directions are correct.
You have high blood pressure. Your medicine should help you. Take one pill before you go to sleep. Never miss a day. By the end of the month, come to see your doctor.
That's right.
This is very good. This is very good.
Скажи, чтобы все понятно.
She understands.
Спасибо. Большое
She says,
спасибо.
thank you very much.
Oh, you're welcome.
Все в порядке?
Since blood may contain the hepatitis B virus or the virus that causes AIDS, blood spills must be cleaned up quickly in order to prevent the spread of infection.
To clean a blood spill, you will need protective gloves, a red plastic bag, paper towels, disinfectant spray, and a wet floor warning sign. Wearing protective gloves, use the paper towels to wipe up the blood. Dispose of the towels in the red plastic bag, being careful not to contaminate the outside of the bag. Spray the area with the disinfectant until it is glistening wet. A solution of 1 part bleach to 10 parts water is an effective disinfectant spray. For complete disinfection, allow the area to air dry. Remove the gloves and place them in the bag. Again, be careful not to contaminate the outside of the bag. Then tie off the bag and discard it according to your facility's policies. Finally, be sure to wash your hands when you are finished.
You have to wash your hands before and after, tending to each patient or piece of equipment that you use. The first step is to take off any rings, except for plain wedding bands or other jewelry. You can put your watch back on, but the rest of your jewelry should be stowed in your pocket. Or better yet, leave it at home so you don't have to bother with it in the first place. Stand away from the sink. You don't want to touch it with your hands, arms, or clothing. Turn on the water and adjust it so that the temperature is comfortable for you. Next, wash your hands and your wrists, making sure that your hands always stay lower than your elbows at all times. You don't want water, even clean water, running up your arms. And don't rest your arms on the sink. Apply soap to your hands and your wrists. Medical offices use special antibacterial soap, but that doesn't mean you don't have to do a thorough job. Scrub your hands vigorously for 2 minutes in a circular motion, making sure your fingers are interlaced periodically to clean between your fingers. Use the palm of the hand to clean the back of the other. You need to spend 3 minutes scrubbing. Rinse, then use a nail brush or orange stick to clean each nail. Lather up and rinse again. When you're finished, rinse your wrists and hands again. Remember to keep your hands lower than your elbows. That prevents contaminated water from running into your arms. You dry with a paper towel or 2, moving from fingertips to wrists. Once your hands are dry, use a paper towel to turn off the water so you don't recontaminate your hands. And dry off the counter with another paper towel, being careful not to touch the countertop. I know that there are 4 main types of waste. The regular stuff like bottles and paper towels, chemical waste like germicides and cleaning solvents, radioactive waste, and infectious.
Well, fortunately, radioactive is one that we don't have to worry about. Riverside's a family practice, and any patients that need x-rays or cancer treatments would usually be referred to another facility. We can look at x-rays, but we don't take them here. Regular trash, like paper towels, usually go into a waste bin. Just an ordinary can. Recyclable things like bottles go into these special blue cans. The cleaning service picks those up at night, and they go in a dumpster in the back, outside. The town comes to pick them up. Chemical waste, like germicides and cleaning solvents, usually go into buckets, and then those are picked up by a different service outside. Infectious waste like this, anything at all that contains body fluids, goes into these red biohazard waste bags. Sometimes they're orange. Then the bags go into a special biohazard waste container. The container has a clearly labeled biohazard red symbol on the outside. These are also collected by an outside firm.
What do you do about the bags that break?
Well, if a biohazard bag breaks, the first thing that we do is we put a second bag around it. Don't ever remove infectious material from the broken bag. Could you open that for me, Joan? Needles and other sharp objects should be disposed of in a rigid, puncture-resistant container like this one. By the way, these are non-recyclable. Whenever you're handling sharp objects, keep the container upright and replace it when it's about 2/3 full. And never ever reach into the container or try to push anything that's stuck down.
That was underlined in the text.
Well, it should be, because you could really hurt yourself. Another thing that we should review is protecting yourself when you have to handle or be near bodily fluids. I know you've seen many pictures before and you've probably practiced it, but let's just run over some of the basic rules whenever you're handling any kind of bodily fluids. You need to wash your hands whenever you see a new patient or handle any kind of specimen. It'll become automatic. Gloves should be used whenever you're in contact with blood or other body substances, and always change between patients. If you're assisting in surgery or any time there's a risk of splattering, wear a gown or apron and a face mask or eye shield to protect yourself.
Besides the standard precautions, there are some common sense things you can do to protect yourself as well, like keeping long hair tied back, keeping your nails short, and not wearing excessive jewelry, and wearing shoes with a closed toe and a low heel that won't slip. Might sound simple, but that doesn't mean it isn't important.
OSHA regulations for protecting workers require that universal precautions be observed whenever there is a risk of contact with any potential source of blood-borne infection.
Good morning, Anita. I'm Jillian. How you doing today?
Well, I could be better. I think I'm getting the flu.
Oh, okay. Well, before you see the doctor, I just need to perform a couple of tests. First, we're going to step in here so I can weigh you.
Oh, come on now, Jillian. A woman never wants anyone to know her weight. Can I take off my shoes?
Absolutely. I always do. And remember, your chart is not a public document.
And I'm thankful for that. But I don't want to know either, so don't tell me, okay?
No problem. Okay, let's go back into the exam room now. I need to take your blood pressure and do a couple more things before you see the doctor.
Okay.
Go ahead and sit down on the table over there. You know, according to your file, you've actually lost some weight.
Really? Well, that's not so bad then.
I'm going to take your temperature. Do you smoke?
No, why?
Well, smoking can affect your temperature. So can drinking fluids, but only if we were using an old-fashioned glass thermometer. But you're fine. Open up.
If you're using a mercury thermometer for any reason, you have to shake it down to 95 degrees and make sure that it's not chipped, that all the glass is intact. There are also digital thermometers that you can use with throwaway sleeves for each patient and the newer disposable strips. You should probably be prepared to use all of them.
Wow, that's fast.
Technology, isn't it great? Looks like you do have a slight fever.
Well, that figures. But at least I lost some weight, so it's not all bad news.
Hi, Mike. Many thanks for letting me use you to demonstrate venipuncture. We're going to use the vacuum tube method. It's the safest, a totally enclosed system, and the most economical. It's also a favorite because multiple blood samples can be taken in a short period of time from one puncture site. Each of these vacuum tubes has a different colored stopper. Each colored stopper, except the red one, contains a different anticoagulant or additive which keeps the blood from clotting. Once you're ready to begin, you're going to screw the needle into the plastic holder. Insert the tube into the other end of the holder. The top of the color stopper should reach the thin guide on the holder. Don't press the tube. If your tube exceeds the thin line, throw it away because it may not have a vacuum. Mike, have you ever fainted before?
No, not that I can remember.
Well, I'm going to ask you to stretch out on the table anyway. Is one arm better than the other for finding a vein?
If there is, I don't know.
Okay, well, we'll just use the right, okay? Next, put on exam gloves. And place the patient's arm in an extended position with the palm facing up. The tourniquet goes about 2 inches above the antecubital space. The antecubital space is here, where the upper and the lower arm meet. Place the middle of the tourniquet on the elbow side like this. Crisscross the ends, and while holding one end stable, tuck the other end in. This creates a tie that can be quickly released with one hand. Next, palpate the vein with your fingertips like so. If you can't feel a vein, try the other arm. Prepare the site with an alcohol pad by rubbing in a circular pattern beginning at the insertion site. Then stabilize the vein with your non-dominant hand 2 inches below the insertion site and pull the skin towards your other hand. Now you're ready to insert the needle while holding onto the holder with your dominant hand. Insert the needle bevel up smoothly and rapidly at a 15-degree angle with the bevel up. The needle only needs to be inserted just past the bevel.
When you insert the needle, don't push it in too far because you can puncture both vein walls. Also, it's key to keep the needle in line with the vein.
While stabilizing the holder, push the tube into the holder. Use your thumb and middle finger to push the tube into the rubber sleeve. The vacuum tube automatically fills to 3/4 full. Once the tube is filled, remove it carefully without moving the needle and apply a second tube if needed. Always roll the tubes 5 or 6 times after you remove it to allow the blood to mix with the additive. Once you've inserted your last tube, immediately release the tourniquet, remove the tube from the rubber sheath, and then remove the needle while covering the site with a gauze square. Okay, Mike, you're going to need to apply pressure here just for a few minutes. While Mike is holding the gauze, attach the safety cover and discard the needle in the sharps container. Then gently rock all the tubes 8 to 10 times in a figure of 8 pattern. This is to mix the samples. And don't forget to check on your patient. How you doing, Mike?
Fine.
Let's keep the gauze on for a little longer, and then I'll apply a Band-Aid. There you go, Mike. You can leave whenever you're ready.
What about the results?
The doctor will call you in a couple of days.
One cardiac cycle is completed, and this happens in less than 1 second. The contraction phase produces the pressure required to move blood into the systemic and pulmonary circulations. The relaxation phase allows each chamber to refill before the next contraction. One complete contraction phase of the cardiac cycle is called systole. One complete relaxation phase is called diastole. Blood pressure varies according to the cardiac cycle. The diastolic pressure is the lowest pressure occurring during ventricular relaxation, whereas the systolic pressure is the peak pressure that occurs during ventricular contraction. The 4 chambers of the heart alternate between contraction and relaxation in a concerted fashion. This pattern is called the cardiac cycle. During the cardiac cycle, the heart chambers beat cyclically to enable a coordinated flow of blood. The cardiac cycle begins when blood fills the atria. The right atrium is filled by veins that carry deoxygenated blood from the body, and the left atrium is filled by the pulmonary veins which carry oxygenated blood from the lungs. The atria are now filled with blood, while the ventricles are relaxed. Some blood flows passively from the atria to the ventricles at this time. The cardiac cycle continues when the atria contract, forcing blood into the relaxed ventricles. Valves prevent the backflow of blood from the ventricles to the atria. Next, the atria relax and the ventricles contract. Deoxygenated blood is pumped out of the right ventricle into the pulmonary arteries, while oxygenated blood is pumped out of the left ventricle to the rest of the body. Valves prevent the backflow of blood from the attached blood vessels to the ventricles. One cardiac cycle is completed, and this happens in less than 1 second. The contraction phase produces the pressure required to move blood into the systemic and pulmonary circulations. The relaxation phase allows each chamber to refill before the next contraction. One complete contraction phase of the cardiac cycle is called systole. One complete relaxation phase is called diastole. Blood pressure varies according to the cardiac cycle. The diastolic pressure is the lowest pressure occurring during ventricular relaxation, whereas the systolic pressure is the peak pressure that occurs during ventricular contraction.
In addition to universal precautions, you should also observe standard precautions. Standard precautions are infection control recommendations issued by the CDC. Standard precautions apply to blood, all body fluids, secretions and excretions except sweat, non-intact skin, and mucous membranes. Observing standard precautions will satisfy OSHA's Universal Precautions Regulation, provided that all other provisions of the OSHA regulation are met.
In some instances, additional personal protective equipment is necessary to prevent the spread of infection.
For example, standard precautions require that a face mask, protective eyewear, and a gown be worn when there is a risk of blood or other body fluids, secretions or excretions splashing on your face or contaminating your clothing. A type N95 respirator is required when airborne precautions have been ordered, such as for tuberculosis. Always wash your hands before putting on personal protective equipment. Face masks and eyewear protect the mucous membranes of your eyes, nose, and mouth whenever there is a chance that blood, body fluids, secretions, or excretions will splash, splatter, or spray. Some face masks may become ineffective when they get wet. A gown may be used to protect your clothing. Unfold the gown so the opening is at the back. Put your arms into the sleeves of the gown and fit the gown at the neck, making sure that your uniform is covered. Reach behind and fasten the adhesive strip. If the gown has ties, tie a simple shoelace bow. Grasp the edges of the gown and pull to the back. Overlap the edges and roll them together in the back, closing the opening and covering your uniform completely. Tie a bow at the waist or fasten the adhesive strip. Gloves must extend over the cuff of the gown. After using the protective gown, remove your protective gloves and discard them. Unfasten the waist and loosen the gown. Open the neck of the gown. The neck fasteners are considered clean. Remove the gown by rolling it away from yourself into a ball. Roll it with the contaminated portion inside. If the gown was used where special contact precautions have been ordered, it should be discarded inside the room. Then remove the mask. If large amounts of blood or infectious material are on the gown, remove the gown with your gloves on. Remove the gloves after the gown has been disposed of and before removing your mask. Respiratory protection, such as a type N95 respirator, is needed when airborne precautions are required, such as when entering the room of someone with tuberculosis. Face masks only protect against splashes and cannot provide adequate respiratory protection. Make sure the respirator makes a complete seal around the face so that unfiltered air that could be contaminated is kept out. Finally, remember to wash your hands after giving care.
But the focus of this training program is how to prevent occupational transmission of bloodborne pathogens. There are 3 major modes of transmission on the job. Puncture wounds from contaminated needles or sharp instruments account for most of the documented cases of healthcare workers being infected on the job. An accidental puncture wound with a conventional needle can easily transmit a bloodborne infection. Safer devices greatly minimize the risk of an accidental puncture wound by removing or shielding needles, as in this case. Mishandling of a suture needle, scalpel, or other sharp could also infect you, as could being punctured by sharps hidden in dirty linen, or a puncture wound from contaminated broken glass. All of these can transmit bloodborne infection. Conversion rates from a single needle stick injury to infection vary, as seen in this comparison of HBV, HCV, and HIV. Needle stick injuries involving contaminated hollow-bore needles, like those used for injections, blood draws, and IVs, are most often associated with transmission. Another mode of transmission in the workplace is contact with blood or body fluids at the site of an open wound, cut, or broken skin. Although unlikely, even breaks in the skin that are too small to see, like nicks around your fingernails, are big enough to let the pathogens into your body. A dry skin condition or rash can also create invisible breaks in the skin. For example, if precautions are not taken, you could become infected through breaks in your skin during a dressing change or while disposing of contaminated objects. The third major mode of transmission is through the mucous membranes that line your eyes, nose, and mouth. If precautions are not taken, you could get infected if infectious fluids splash into your eyes, or if you touch your eyes, nose, or mouth when you have infectious material on your hand. In addition to knowing the modes of transmission, it is also important to know how you do not get these viruses. They are not transmitted by casual or environmental contact. Normally, shaking hands, using telephones, toilet seats, and drinking fountains will not cause bloodborne infections, nor will donating blood.
Another vital sign is respiration. Respiration is the process of inhaling and exhaling. Measuring respirations includes counting the number of respirations per minute and observing for signs of abnormality.
Abnormal breathing signs include shallow breathing, labored breathing, where the person struggles to breathe and may make gurgling, rattling, or wheezing sounds, stertorous breathing, where the person makes noises like snoring when breathing, abdominal breathing, where the person uses mostly abdominal muscles to breathe, irregular breathing, where the depth and rate of breathing is not steady, and Cheyne-Stokes breathing, where breathing alternates between slow, shallow breathing and faster, deeper breathing. To measure respirations, you will need a watch with a second hand and a pen and paper to record the result. Be sure to wash your hands before giving care. In order for you to get an accurate measurement, the person must be unaware that you are counting respirations.
Mrs. Brown, I'm going to measure your vital signs, all right?
Sure.
Therefore, respirations should be measured immediately after measuring the pulse. Simply continue to hold the wrist after measuring the pulse. And watch the chest. If you cannot see the chest rise and fall, hold her arm across the chest and feel the chest move. Look and listen for any signs of abnormal breathing. One rise and one fall of the chest counts as one respiration. Count the respirations for 1 full minute. Adults normally breathe at the rate of 16 to 20 respirations per minute. Write down the number of respirations per minute and ensure comfort. Remember to wash your hands after giving care and report any unusual observations immediately.
Measuring blood pressure is next, and it can be a little difficult at first. It will take practice, but it is extremely important to measure blood pressure accurately.
Blood pressure is the force of the blood pushing against the walls of the blood vessels. When you measure a blood pressure, you are measuring two things: systolic pressure and diastolic pressure. The systolic pressure is the pressure at the time when the heart contracts and pumps blood into the arteries. The pressure is highest at this time. The diastolic pressure is the pressure at its lowest point, when the heart is relaxed. In healthy adults, the normal systolic pressure ranges from 100 to 140 millimeters of mercury. The diastolic pressure ranges from 60 to 90 millimeters of mercury. Many elderly persons have high blood pressure called hypertension. Low blood pressure is called hypotension. To measure blood pressure, you will need a sphygmomanometer or blood pressure cuff. This is an aneroid blood pressure cuff. It has a cuff that wraps around the arm. There are different cuff sizes. It is important to use the correct cuff size, as using a cuff that is too wide or too narrow will result in an inaccurate reading. The bulb is used to pump air into the cuff. The valve is used to release air pressure from the cuff. The manometer indicates the amount of pressure in the cuff. The long lines represent 10 millimeters of mercury. The short lines represent 2 millimeters of mercury. For example, this reading is 120 plus 2 short lines for a reading of 124. You will also need a stethoscope, 4 antiseptic pads, and a pen and paper to record the result. Be sure to wash your hands before giving care.
Mrs. Brown, it's Virginia Daniels. May I come in?
Please do, yes.
Identify the person and tell her what you are going to do.
I'm going to measure your blood pressure, all right?
Okay.
Have her rest comfortably, either sitting or lying down. Provide privacy. Lower the side rail if necessary. The left arm must be bare up to the shoulder and should rest comfortably on the bed or arm of the chair. Unroll the cuff and loosen the valve on the bulb. Be sure the compression bag is completely deflated. Then wrap the cuff snugly and smoothly around the arm, about 1 inch above the elbow. The cuff should not be able to rotate around the arm or slip down. The arrows on the cuff should point toward the brachial pulse, located here. Be sure the manometer is in position so that you can read the numbers easily. Locate the radial artery and palpate for the radial pulse. When you feel the radial pulse, close the bulb valve by turning it clockwise, and quickly inflate the cuff until the manometer reads 50 millimeters of mercury. Then, continue to inflate the cuff in increments of 10 millimeters of mercury until you can no longer feel the radial pulse. Read the manometer at this point. This reading indicates the palpated systolic pressure. Make a mental note of this reading. Deflate the cuff by turning the valve counterclockwise and have the person raise their arm and flex their fingers. Finding the palpated systolic pressure in this way will prevent you from underinflating the cuff when measuring blood pressure. To prevent the spread of infection, wipe the earplugs of the stethoscope with the antiseptic pads. Then wipe the diaphragm. Put the earplugs of the stethoscope into your ears. With your fingertips, find the brachial pulse on the inner side of the arm. Hold the diaphragm of the stethoscope firmly against the skin without touching the cuff. Close the valve by turning it clockwise until it is tight. Holding the stethoscope in place, squeeze the bulb to inflate the cuff. Inflate the cuff until the manometer shows a pressure 20 to 30 millimeters of mercury above the palpated systolic pressure you noted earlier. Turn the valve counterclockwise to allow air to escape slowly. Listen for the sound of the pulse to return. Be ready to note and remember the manometer reading when you hear the sound. This is the systolic pressure. The systolic pressure in this case is 136. Continue to let the air out slowly. Be ready to note the pressure reading when you hear the pulse sounds change to a softer or faster thud or disappear. This is the diastolic pressure. The diastolic pressure in this case is 80. Now, for practice, listen for the systolic and diastolic pressures. When finished, deflate the cuff completely. Record your reading. Indicate which arm was used and whether the person was lying, sitting, or standing. Write the systolic pressure above the line and the diastolic pressure below the line. If there is a change in the blood pressure, report it immediately. Remove the cuff and roll it up over the manometer. Wipe the earplugs and diaphragm of the stethoscope with antiseptic swabs. Raise the side rail and be sure the person is comfortable. Finally, remember to wash your hands after giving care and return the equipment to its proper place.
Measuring vital signs is an important skill that must be learned and practiced. The measurements you take enable you and other members of the healthcare team to provide the highest quality of care possible. Another vital sign you will need to measure is the pulse. Measuring the pulse is a simple way to determine how the circulatory system is functioning. Every time the heart pumps blood, the pulse can be felt at many parts of the body. One of the easiest places to feel the pulse is at the wrist. This is called the radial pulse because the heart is pumping blood through the radial artery.
When measuring the pulse, you should note the rate or the number of beats per minute, the rhythm or regularity of the pulse beats, and the force of the beats, whether normal, weak, or strong. To measure the radial pulse, you will need a watch with a second hand and a pen and paper to record the result. Be sure to wash your hands before giving care. Identify the person and tell her what you are going to do.
Mrs. Brown, I'm going to measure your vital signs, all right?
Sure.
Provide for privacy and make sure the person is resting comfortably. The arm should be well supported and relaxed. Find the pulse by placing the tips of your 3 middle fingers about here, in line with the thumb, directly next to the bone. Apply light pressure until you feel a beat. If you press too hard, you will block the flow of blood and you will feel no pulse. When you have found the pulse, note the rhythm. Is the beat steady or is it irregular? Also note the force of the beat. Is it normal or is it weak or bounding? Then note the position of the second hand on your watch. Count the beats until the second hand reaches that position again, 1 full minute. You should feel between 60 and 90 beats per minute. If the pulse is regular, you may save time by counting the beats for only 30 seconds. Then multiply this number by 2 to calculate the beats per minute. Be sure to write down the pulse count immediately and continue measuring the other vital signs. Remember to wash your hands after giving care. Finally, be sure to report a pulse rate under 60 or more than 90 beats per minute. Also report a weak pulse or a bounding pulse, and report any change in rate, rhythm, or force from previous measurements.